Now we are going to start about the spleen. Spleen is also a secondary organ of a lymphoid system in which there is B and T cell proliferation, and it allows the cell to interact with the antigen. The basic and main fact is that it filters blood, not lymph. Before talking more about it, I want to simplify the diagram of a spleen, the structure of spleen. For example, that is spleen, and it filtered the blood, so there will be splenic artery taking the blood towards the spleen, and there will be a splenic vein that will take blood out in the spleen. There is two parts, white pulp and red pulp. White pulp and the red pulp. These pulps further having their own important structures. The white pulp having three important structures. First is follicles. Second, there is one structure, PLS, means very anterior lymphatic sheet, and on the margin there is one area called marginal zone. In a red pulp, the most important thing is sinusoids. Okay. The spleen having two parts, white and red pulp. The white are having three parts, follicles and the periarterial lymphatic sheath and marginal zone, and red pulp only having important part, that is sinusoids. Okay. In that white pulp, the follicle going to make the B cell, and the follicle having the mantle zone and germinal center as in the lymph node. That is mantle zone, and in the between it is the germinal zone. Then marginal zone and periarterial lymph node sheath is going to go to the T cells. And the sinusoid, in the red pulp there is a sinusoids, reticular fibrous framework. And further, if we talk about the periarterial lymphatic sheath, that is part of the white pulp, it contains T cells and located within white pulp. The follicle contains a B cell and located in the white pulp. And the marginal zone, what is doing? It contains the macrophages and specialized B cells. It is site where the antigen presenting cells capture the blood-borne antigen for recognition by the lymphocytes and located between the red pulp and white pulp. If you guys know about the activation of the macrophages or opsonization of macrophages, then I will want to say that, for example, this is a macrophage. On this macrophage, when antigen will be attached, for example, IgG, and after that IgG will be this cytokine and activate the complement system, and that complement system C3b will be attached to the microorganism and attract the macrophage. The macrophage will come and engulf all the microorganisms. Okay, this one is a process. And how it will going to active all the process, how it adaptive immune response. These are dendritic cells that express the molecular dendritic cells that going to express the molecular histocompatibility 1, 2 and the B7, and these enter in lymph with antigens and then enter into lymph node, and there's a many B and T cells waiting for antigen to express, and then that dendritic cell present the antigen to T cell, and then there will be APC antigen presenting cell in the lymph node that process through antigens, and there will be B cell that react to the antigen, and that is called the adaptive immune response. Now we are going to read about that with the location of spleen. The spleen is located in left upper quadrant of abdomen, and it's the anterior atrial to the left kidney, and it is protected by 9 to 11 ribs. And splenic dysfunction, like in some patients, spleen is not working, is mostly due to post-splenectomy or sickle cell disease auto-splenectomy. What does mean? Post-splenectomy, after the dysfunction of spleen or a removal of spleen due to different conditions, we are removing the spleen. The main condition is, if you guys know, hereditary spherocytosis. Hereditary spherocytosis. What is happening in that? There is abnormal shape of the RBC. The spleen is doing, and there is anerocytes of doing the removal and destruction of the abnormal cells. So what is happening? There will be anemia in that patient. What we will do splenectomy, remove the spleen, so there will be decrease the risk of anemia. And after that, there will be some signs and symptoms. Sickle cell disease, what is going to happen in sickle cell? All the RBC are abnormal. The spleen is doing overwork. Due to doing overwork and removal and destruction of all lot of RBC, it will going to auto-splenectomy, auto-dysfunction. And by the way, they will decrease in IgM, decrease in complement activation, decrease in CT pre-opsonization, and there will be increase in susceptibility to encapsulating organism. I already told you how encapsulating organism going to opsonize. First, there will be attachment of Ig immunoglobulins, IgG or IgM, and then there will be complement C3P, and then the microphage go to eat a phagocyte of that encapsulated organism. If spleen is going to dysfunction, if we are removing the splenectomy, then there is an increase in risk of encapsulated organism. What the encapsulated organism is most common such as streptococci pneumonia. Streptococci pneumonia. And it causes death in more than 50% of cases, it's causing the death. And for that organism, we are doing vaccination of that patient that having splenic dysfunction, and this is most for the pneumonia, Meningococci, Haemophilus influenza type B. And what is you will find in the body in the patient after post-splenectomy findings, like if a patient having no spleen, what type of findings you will be see? What are the findings in that patient? First is the whole jolly bodies. There is nuclear remnant, for example. That is the RBC. In that RBC, we find a small nucleus. Okay, a small nucleus. Like that, and these are horizontal bodies. But if the spleen is working good, then automatically the spleen will destroy these cells. But now these cells are present in the peripheral plasmia, and you will see the horizontal bodies. Thrombocytosis. Why thrombocytosis? Because in spleen there is a storation of circulation of platelets. If there is no, if you are having no spleen, then there will be no deposition of platelets, no the regulation. There will be no one who will do the regulation of the platelets. So there will be thrombocytosis. And lymphocytosis, same. After the function, there will be destruction of the lymphocytes, and there will be storation of lymphocyte inside the spleen. If there is no spleen, then there will be also lymphocytosis. Okay, this is all about the spleen. And if you guys again you find it have two type of pulp, white and red pulp. In the white pulp, there will be increase in the B cells in the follicles, and periarterial lymphatic sheath having the T cells, and also in the red pulp there is sinusoids that having the macrophages, and also macrophages having a different name according to their places. Like in liver it is far cell, in the brain things the microglia, in the bone is the osteoclast, etc.